let me thank you so much for hanging in there. It's been a long day. My brain is full, overflowing, but I am so excited for our final speaker. So Amy Whitcomb Slemmer is the Executive Director of Healthcare for All Massachusetts. She became Executive Director in 2008 after 20 years of health policy and management experience. She has been crucial in supervising the implementation of Chapter 58, which is better known as Massachusetts healthcare reform. Prior to joining Healthcare for All, she had a diverse career in Washington, D.C. She served as an executive officer of American Red Cross Biomedical Services. She was the executive director of DC Vote, which was working towards gaining national attention to help local residents obtain full congressional voting rights. She served as legislative counsel for the National Association of People with AIDS, and she was the founder of Slemmer & Associates Grassroots Advocacy. She has a JD from Georgetown University Law Center and graduated with honors from Wheaton College with a Bachelor of Arts degree. Please join me in welcoming Amy Whitcomb Slemmer.
Oh my goodness, thank you so much. So just so I'm clear, I am all that stands between you and cocktails, is that right? And you've been here a long time. It is an incredible pleasure for me to be here with you and to be able to talk some about Massachusetts. And my invitation to you, first of all, I'm grateful that you've hung in there today. I know you've learned lots of things. My invitation is to consider what I have to say to be you guys 7 years from now. So what I thought we would cover is, as I say, a brief introduction. I am going to talk about what we did in Massachusetts. Then some general things about what to expect when you're inventing. You guys are on the cutting edge, on the front lines of making sure the Affordable Care Act is successful in Missouri. I'm going to talk some about challenges and opportunities, and then I want to make sure that we have time for questions before we end. So this is what we think of as the healthcare system in Massachusetts. It's a balancing act that requires access. It has to be affordable so that people sign up. It has to deliver quality, high quality care. And there's an important role for public health. And in Massachusetts, because we've been so successful in getting people coverage, we're now working hard on our public health system, which we believe invests in a cost-effective way to keep people healthier than they would be otherwise. So I want to tell you a little bit about Healthcare for All. We are the consumer and patient voice for health reform in Massachusetts. We've been around for 30 years. This is work, the culmination and passage of Chapter 58 is the culmination of decades worth of work in the Commonwealth. And we have been moving forward and trying to represent and move to a more consumer-centered healthcare system so that it provides affordable, accessible, culturally competent, high-quality care for everyone. And our mission requires that we pay most attention to those folks who are vulnerable. And you'll hear that we consider almost anybody can be considered vulnerable in Massachusetts. Our national partner is Community Catalyst, and I'm thrilled that you guys have a Community Catalyst representative in Dara Taylor, who is marvelous to work with, and is an excellent resource as you're trying to figure out what happens in Missouri, what's happened in other jurisdictions. Community Catalyst provides technical assistance all across the country. We do our work at Healthcare for All in coalitions. We provide a table for unlikely allies to sit together with a shared interest. Our Affordable Care Today coalition is widely recognized as a force for good and change in Massachusetts. We have people sitting there who represent insurers, providers, consumers, some religious groups, and there are some representatives from our state government as well. And when that group decides that they have a shared interest, which we did when we decided we wanted to tackle the coverage issues 7 years ago, they really can get work done because they agree to stick to principles and move forward, putting aside some of their individual interests so that we have a shared, we can work toward a shared good. I think it's incredibly important to be transparent, and I want to make sure you all know where our funding comes from at Healthcare for All so that you can assess, you can understand what my perspective is. We are about a $3 million organization. As I say, we're almost 30 years old. And we have a variety of funding sources. We have a couple of government contracts because we actually do sign people up for health insurance and provide some support for government functions. We enjoy private foundation support from the Robert Wood Johnson Foundation and several other national and some local family foundations in Massachusetts. We get some corporate support. So one of the things that we're very fortunate to have in Massachusetts is an appreciation for the need to have consumers at the decision-making table. And there are corporate partners in Massachusetts willing to support that work. And then one of my favorite parts about Healthcare for All is that we get hundreds of checks from individuals that are for $5 and $10 from people who have received help through our helpline, and want to say thank you. It's all that they can afford, but they've made a connection with Healthcare for All, and they send us a little bit of money. And to hear their stories is one of the great privileges of doing this work. And I'm going to talk some about their stories, and very much appreciate that the foundation this afternoon is asking you all to share your stories. Stories are incredibly powerful. So this is what we looked like in 2006 when Chapter 58 was signed. That is Governor Romney. This was a bipartisan effort. It may be a surprise after you've listened to the national presidential campaign, but in fact, you could call what we did in Massachusetts Romney Care if you needed to. It is the foundation for what became Obamacare, and it was incredibly important that we have support across a political spectrum. And here is a piece of trivia, and I will say, I love that my former boss is in the background. My first job in Washington was working as a health aide for Senator Kennedy. So they all were there. This was his life's work and ambition. Here's a piece of Massachusetts trivia. If it ever comes up, I've yet to see it on Jeopardy, but in the official gubernatorial portrait in the State House of Mitt Romney, he is holding up a piece of legislation. He's holding up the Affordable Care Act. He's holding up Chapter 58. So it was among his proudest accomplishments and hangs in the governor's office to this day. Very briefly, here's what it looks like in Massachusetts. Since enactment of Chapter 58, health reform, we have increased our healthcare coverage rate so that we have more people covered by percentage in Massachusetts than anywhere else in the country. It is extraordinary, the work that's gone on and the results that we've had. Almost everybody in Massachusetts has health insurance. So we have 96% of adults and 99.8% of children in Massachusetts, which, by the way, if you don't know anything about our demographics and population, that means there are 3,000 kids we haven't reached yet, somewhere in Massachusetts, and Healthcare for All is determined to go find them. Yay. And I have every faith that 7 years from now, you'll be able to quote some of the same statistics because of the incredible work that you all are poised to do. One of the things we know in Massachusetts is that this is incredibly personal. Think about it from your own perspective. To talk to somebody about what your healthcare issues are, to talk to somebody about what your income is, that is personal and touchy information that we're going to have to figure out how to build into our conversations that will lead to getting people healthcare coverage. And one of the things that we learned in Massachusetts is paying attention to individual stories is incredibly powerful and important. So you can talk all you want about, a national debate and the political discord that we have and disconnect that seems to come out of Washington. But on the ground, you will be talking to individuals and families who are uninsured and are one accident away, are one chronic illness away from disaster. So this is a story of Anna and Ben who didn't have health insurance, but realized that we have an individual mandate in Massachusetts. So when we passed the bill in 2006, they signed up for coverage and qualified for Commonwealth Care. In Massachusetts, that's one of the programs that has subsidized coverage so you get some subsidies for your insurance premiums, but you also pay money out of your out-of-pocket. So when Anna was pregnant with their first child, they realized they needed some assistance in prenatal care and that they were going to deliver a baby and needed health insurance. They signed up and had regular checkups When their child was born, Matthew was diagnosed with a very rare form of cancer. So this joyous event took a very difficult turn. They found that he also had an enlarged liver. It was 3 times the size of a healthy baby's liver. And Anna and Ben were devastated. I would say, talking to Anna and Ben, the idea that they would also have to navigate and take care of this incredibly painful issue without health insurance would have simply been devastating. But because they had insurance, Matthew got chemotherapy right away, which was the cutting-edge treatment that was recommended, and he had months in the intensive care unit, just months of a stay, and you can imagine what those hospital bills would have looked like. Thankfully, their insurance covered the help that Matthew needed, and I'm delighted to say he's 2 years old now and incredibly healthy, and before I left to come here, we checked in, and he is a thriving 2-year-old whose favorite activities are throwing blocks and eating ice cream, which sounds pretty good, actually. So we figured out that really, to be successful in Massachusetts, we need a coordinated effort. And part of the joy and pleasure of listening to some of you this afternoon has been listening to you making connections, which will serve you so well in the future. We know that you absolutely have to collaborate. And I was interested at lunch to see which groups are navigators and which groups have some other federal funding and which groups are getting subsidized and grant funding from the foundation. I will say at Healthcare for All, we were not chosen to be a navigator, and we applied. We, however, do receive money through the Community Assistance Program, the Consumer Assistance Program, which is also another source of support that helps support our outreach and education work out in the field. There is a tremendous amount of work that needs to be done, and we can't be successful without taking on some new and innovative strategies, forming new relationships, and getting smart about what this law actually provides. So here's just an example of what we did in Massachusetts. We went to a Massachusetts institution that has a reach and is attractive beyond anything Healthcare for All could have envisioned, and we partnered with the Boston Red Sox. We sent out notices and information, press releases, and thanks to somebody who was quick-witted at the Red Sox organization, they actually would do a scroll during games at Fenway Park talking about signing up for health insurance and inviting people to call our Health Connector's phone number. So in Massachusetts, we have a state-based exchange called the Health Connector. And this is the information that the connector actually sent out. We thought it was incredibly important, again, with the eye on the prize of getting people coverage, it's incredibly important to do that work and send out information in appropriate languages. So Healthcare for All, we have services that are provided in English, Spanish, Portuguese, and Italian. That leaves out a whole host of communities that we know we want to serve and we want to make sure we reach into, but we've partnered with other organizations that have Haitian Creole speakers, that have other that represent other communities, and I would invite you all to do the same. Nobody's expecting you to be able to serve everybody in Missouri, but all together, working collaboratively, you can find everyone you need to. So I wondered about you all partnering with some of your own storied institutions until I read the newspaper yesterday and read an editorial about, you guys have it tough, I'm so sorry, about absolutely lambasting us for considering taking the Medicaid expansion here in Missouri, and about why that would be just a god-awful, terrible thing. I don't know how many of you share that perspective. I have to say, I'm hoping that's giggle is that not many share that perspective. Because there are people desperately waiting to qualify for Medicaid. There are lives to be saved, as we found in Massachusetts, because they have access to Medicaid. I very much appreciate the concern that was expressed in the paper had to do with becoming dependent on federal funding. The fact is, we're not letting people die in the streets, thank God. We also know that there is money to be saved if people have access to preventive and primary care up front, rather than waiting for an acute episode and going to the emergency room. Okay, now I know where you stand on Medicaid expansion, and I very much appreciate that. Again, here are some other outreach methods that we use that were really wonderfully successful. And one of the things we learned was that you need to you have to have, your messages need to change and become more and more granular. So this is simply an example of an ad that was sent out and sponsored by our Health Connector that talked about what would happen if you don't get insurance. So in fact, in Massachusetts, we had penalties included, just as the Affordable Care Act has penalties or fees, as we call them in Massachusetts, if you decide, and you have every right to decide that you don't want health insurance, but if you decide to opt out and not buy it, then you pay a fee. And we wanted people to understand that that was going to be a progressively expensive fee. So right now, we're at about $1,100 a year if you decide to opt out. I will say, as you saw in our statistics, very few people have opted out. And I loved the conversation I got to have at lunch today because it reminded me that I should just explain. In Massachusetts, 7 years from where you guys are today, buying health insurance is like buying car insurance. It simply is the way of the world. It's how we live in Massachusetts. But I appreciate that you have some bumps and hurdles to get over between here and there, but hang in there. It's incredibly important. Another personal story. Again, this is part of how we encourage people to consider the ramifications of not buying coverage and not having access to health care. We have Andrew, who was an incredibly accomplished human being, very active, very healthy. He was a runner, and he went out to the garage one day and fell and hit his head. Now, again, this could happen to anyone. Andrew did not have health insurance and was terribly worried about being able to, well, his wife, because he was unconscious, was terribly worried about what was going to happen. He was airlifted to an emergency room and admitted to one of our fine healthcare institutions in Boston. And while his wife is trying to figure out if he's going to live or die, they're also worried about every nurse visit, everything that came into his intensive care room, because again, they had no idea how they were going to be able to afford it. So they called Healthcare for All. We got them healthcare coverage, and it just meant they could concentrate on Andrew's rehabilitation rather than this horrible feeling about what they were going to have to sell and what they were going to have to do and where they'd have to move in order to be able to afford his very long rehabilitation. I will say it is remarkable. He is back on his feet. He had just a terrible prognosis. They were told he wouldn't walk or talk again, even though his brain function came back to being fully healthy. But he is, in fact, walking, talking, and he's back in the classroom teaching. So again, I get to think about all those kids who have the benefit of Andrew's good health and his passion for teaching that we would have lost if he hadn't had healthcare coverage. So this is vitally important, and this is actually the part of the foundation work that you all are doing today. In Massachusetts, it was vitally important that we identify partners around the state. So as I say, Healthcare for All, we actually are a statewide organization, but we sure don't have representatives from the Hmong community or other immigrant populations who will actually respond better and more trusting. There are fewer hurdles to get over if you send someone into the community who's of the community, looks like the folks we're trying to serve. And what we did was brought together these incredibly diverse and committed community-based organizations. Some of them we gave some resources to, we provided some funding for, and some actually, because this was part of their missions work, healthcare coverage was part of their missions work, they came together without support. And I will say, I very much appreciate that Justin was talking about how some of you who are not currently funded might qualify for funding. Let me also remind you that success will lead to better investments. There will be more money available if you guys figure out how to do this work well. And there are tons of people around the country watching to see how this goes here. So I know you're on the cutting edge, and having listened to some of the passion in the room and in some of the conversations and in some of the role playing you're doing, I have no doubt but that you will be successful. So again, not everybody can do everything, but figuring out organizational strengths and resources. there are, I'm sure, wonderful health educators at some of the federally qualified health centers, but there may not necessarily be folks who can reach into libraries, or we went to gas stations. We went all over the place in Massachusetts to find people where they live. And we'll talk some about some of the hurdles that you have to get up and over. But when you have good news to tell people, it's absolutely worth keeping after them so they understand. So those of you, any community organizers in the room, this should seem like, for community organizers, not yet. I hope 5 years from now you all raise your hands. But for right now, this is a very familiar graphic for community organizations. You know, if you are trying to attack the issue of uninsurance and lack of access to the healthcare system, if you do it one at a time, you're going to be gobbled up. The problem is enormous and you'll be gobbled up. If you get organized and try to do this together, you'll have a much better chance of success, and you'll be able to solve the problem that you're going after. You all know folks who are struggling with this law. You all know people who think, and perhaps you have been among the people who think it's too complicated, it sounds hard, you know, I don't have, the insurance companies are big and I don't understand the problem, I don't understand the issues, I don't know how to get healthcare coverage. You are in a position to untangle some of that fear, some of the misinformation. You really have an opportunity to make a tremendous difference. And part of the success stories out of Massachusetts are the result of sticking with it and learning. At Healthcare for All, one of the mantras that we have is we are the last call you have to make. No matter what your problem is, whether you can't get an appointment with the doctor, whether you were dropped off your healthcare coverage because you forgot to re-enroll or forgot to certify that you qualified a year after you originally were insured, no matter what the problem is, we will get in it with you. Again, that forms incredible personal relationships. And when you can forge that, when you can cross the divide that you may have otherwise, it's an incredibly powerful thing if you can capture their story and help other people understand that they are similarly situated, that perhaps they too are worried about an accident, perhaps they too are about to have a baby, or perhaps they have young school-age children and they aren't sure how they're going to pay for immunizations and school supplies. This is a very active time for parents to be figuring out their kids' healthcare needs. And again, there is good news in the Affordable Care Act. I very much appreciate that I've heard from many of you who are in different organizations. And again, I would invite you to think about strengths that you bring to the table. The faith-based community gets to talk about healthcare coverage in different terms. The employment and business community gets to talk about healthcare coverage in economic terms and competitive terms. In Massachusetts, we were told that, again, 7 years ago, there was quite a lot of hand-wringing and fear that businesses would stop offering healthcare coverage to their employees because there would be publicly subsidized coverage available. So that was a real concern. The other concern that resonated with all of us was that health insurance costs would skyrocket because there were going to be unhealthy and healthy people coming into the market. The facts before us in Massachusetts are that neither of those fears came true. I am incredibly grateful to the employer community in Massachusetts. More employers currently offer health insurance to their employees than did 7 years ago. You know what a difference that makes. It's a competitive advantage, and businesses have figured out how to make that a cost-effective expense for themselves. So we've been very pleased, and again, I invite you to think about Massachusetts as a cautionary tale. The other thing that hasn't happened is this spike in health insurance rates. We've brought a lens of transparency to the marketplace. We now know how much increase each plan charges, and that actually has lowered the escalating cost structure, which, again, we monitor very carefully. We want to make sure that insurance is affordable. And one of the things that we haven't talked about that happens in this unusual, in these innovative outreach conversations is people want to know what they're buying. So it's hard to help them understand what's in the benefits package, what's in what their premium dollar will purchase, unless you really get to have a conversation with them. So again, at health fairs, in writing, and as parts of social service agencies, we're able to explain to people what they're actually buying. Another personal story, again, that helps buoy the work that we do at Healthcare for All. Thomas realized that he needed health insurance after he had 2 strokes in the very same year. He never liked going to the doctor. He certainly had not been in for preventative care. He landed in the emergency room twice, and the second time in, somebody asked him if he wanted to apply for health insurance, and he did. Frankly, he was, in his mind, he would tell you that he was thinking about ways to go without the medicine that was going to be prescribed for him after the second stroke. He also was desperately worried that he would not recover and that his children would somehow have to cobble together the resources to take care of him as he would be fully incapacitated. He was very pleased to find out that he was eligible for, again, Commonwealth Care, which is one of our subsidized programs in Massachusetts, and he has made a full recovery. Again, his quote is on the slide, and I hope that you can read it. He talks about the fact that it's made a huge difference to his recovery and to his sense of accomplishment, and his peace of mind has been tremendously enhanced because he worries about having another stroke, but he now goes for preventive care and has an annual checkup, so he feels as though he is much more on top of his health care circumstances than he certainly was a couple of years ago. Here is an ad again that we have used and has gotten us quite a lot of attention. We think it's important to use a variety of media. So it's not just newspapers, we're also on television, helping people to understand how to sign up, helping people understand what resources are available. Sometimes our helpline phone number at Healthcare for All is included in these ads so that people can call from anywhere in the state, our 800 number, to understand what benefits, what subsidies are available, and what is required as part of the individual mandate in Massachusetts. We made sure that we write these ads in, as I said before, as many languages as possible, and then we place them in targeted communities. Again, that's not necessarily an expertise that Healthcare for All has. We depend on our regional partners to actually tell us what the best delivery vehicles are for this information. And we're very pleased with the amount of success we've had. This just symbolizes and explains some of the unusual enrollment efforts we've engaged in. It's not just an ad in newspapers. We have put circulars in people's electric bills. We have been to farmers markets and libraries. And we've been very excited to be going door to door. Again, you can imagine when we show up on somebody's door and say, we're here to talk about health reform, they have every other thing to do but talk to us. And if we hang in there long enough, and we can explain that we're actually from either Healthcare for All or from a local organization, we get to have a conversation and find out what their concerns are, and often there's good news to be had for folks who are worried or are sitting in isolation, not knowing what might need to happen with a relative or with themselves as they're trying to navigate their own health care. So one of the people we ran into while we were going in communities was Janet. And Janet had gotten insurance, as she was required to do in Massachusetts, and she had enrolled in Commonwealth Care. And she did not feel well. Her eyes were itchy, and she was concerned, and because she had health insurance, she went to the doctor. The doctor, the first time through, diagnosed it as a virus, gave her some drops, and sent her on her way. And the problem did not get any better. She went back to the doctor, again, not worrying because she had health insurance and not needing to go to the emergency room. She went back to her same doctor, who she now had a relationship with, and was diagnosed with a very rare infection in a part of her eye that, again, required a more complete exam and diagnosis, and frankly, she was treated and she is now well. Had she not gone to the doctor, she would have risked total blindness. Again, think about the supports that would have been required for Janet if she'd had to suffer total blindness. So this is what the results look like in Massachusetts. I should tell you, we are a state of 6 million people. We only had, we have covered almost everyone. As I told you, our statistics we're very excited. We think we're super fabulous. 400,000 people in Massachusetts have gotten health insurance. And again, to a person, you can imagine, and I know you'll find out directly what a difference that's made to individuals and to families and to the security that they have, being able to continue to have life goals that won't be taken away from them because of an unfortunate incident or illness. We also, as I said, because we are this far out, people take it for granted and they buy health insurance. Again, not the easiest thing the first couple of years, but now it is very much like car insurance. Nobody here would imagine buying and driving a car. You can't do it. It's just not the way. You know you have to buy car insurance. It becomes the same in our experience for health insurance. And now, as I said, we are now working on population health, which I'm happy to talk about. I realize we're getting late in the day, so I don't want to take up a tremendous amount of time now, but I'll talk about what the next phase in Massachusetts is. We're very excited, and I hope I get invited back 5 years from now to be able to talk about what we've done next. The work that we did, as I explained, in the top-down and bottom-up strategy has allowed for ongoing communication. And if there is a lesson that I would invite you all to learn faster than we did in Massachusetts, we had all of our folks out in the field doing their own thing and doing their own work, and we kind of left everybody to go it alone longer than I think we would now. I think we would have gotten everybody back together at least within the first year. We kind of heard anecdotally how things were going. Some groups did well, some groups didn't do well. I think had we gotten together very much like this convening today, we would have been able to problem solve because some group out in the Berkshires had figured out a particular glitch that somebody on Cape Cod would have benefited from earlier than when Healthcare for All pulled everybody together again. One of the things we did, and I appreciate is a bigger challenge in Missouri, but I just encourage you to consider the fact that this law is going to be implemented. It's all about how implementation goes, and it won't be perfect. And you will be experts on what needs to be fixed. I understand that you don't necessarily have a wildly supportive legislature, but I do think it's been really fun reading your paper the last week, I have to say. Your papers. But I think setting the expectation that you want this law to be improved as you go along is incredibly important, and improved from the consumer's perspective. It needs to be easier, it needs to be more accessible. You'll be learning all of that as you go along. And I don't know if this is part of Healthcare for All Missouri's mission and mandate, but certainly in Massachusetts, we help introduce legislation yearly that will actually respond to individual concerns. And I invite you to do that. As I say, you are about to become on-the-ground troop experts on how this law really looks and how it works for everybody. Again, the foundation that we did set, once we did gather people back together, we were grateful for people's different roles, and it was wonderful actually to understand who, in our state, who the navigators are. That's actually really important versus the Consumer Assistance Program. That's part of what Healthcare for All does. And we were able to maximize and not duplicate efforts. So I've talked a bunch, I think, about the linguistic capabilities. There are other special needs as well, and other special populations who absolutely need to be reached out to, but is not necessarily, probably not cost effective for everybody to try to do it. Figuring out how to divide up Missouri and take on the work based on your best skills will make a tremendous difference. It also takes a tremendous amount of work. So here's a story of Amanda, not an unfamiliar circumstance, a woman going to have a baby. She was surprised to find out she was pregnant and knew that she was going to need health insurance, so we got her coverage. And as I'm sure you can understand, understanding a pattern at this point, that Amanda, during one of her prenatal exams, was found to have a brain tumor. And she was very concerned about the effect of treatment on her unborn child. Because she had health insurance, she began a relationship with her OBGYN that actually has extended beyond the delivery of her baby, and was incredibly important that her OBGYN also be talking to a neurologist. And she gave birth to a healthy baby and is expected to be able to recover and see that child through adulthood. So that's just been, again, she would not have gone to the doctor had she not had insurance, and she certainly wouldn't have been able to have the world-class medical care and team surrounding her for her variety of needs that she had because she had health insurance. Again, I cannot say enough about the linguistic capacity and being able to reach into communities based in people's most comfortable language. You have to have folks who speak that language to understand. One of the lessons I invite you to learn is we had a generic translation service take on one of the forms that was coming out of the state's Mass Health Office, and thank God somebody came in our office and said, "Have you tried to? Do you know what this actually says?" And you know, not unlike tattoos that end up saying something totally different in Chinese than what you intended. That's exactly what had happened, and it was just offensive. So ask somebody who actually speaks those languages, and you will save yourself a tremendous amount of time. Again, I would point out, we could have saved a lot of money and heartache if we'd done it right the first time. So I invite you to do it right the first time. The other thing is, and I know this won't come as a surprise, and I've looked at some of the materials here, you have access to marvelous information here. It has to be understandable, it has to be simple, and meaningful for folks. So one of the things that we heard going door to door and in communities is, okay, what's the catch? I'm going to get money, I will have some assistance in buying health insurance premiums. What's the catch? You have to have the information they need. And also, we heard repeatedly, and I am grateful that the Foundation's website actually will help you address this, how much will this cost? People want to know that. You can understand that. And you have a tool to be able to figure that out. So our materials are pretty straightforward, pretty simple, and they include consumers that look like the consumers we're trying to reach into so that people will not just dismiss them as not being relevant to them. Again, lots of community outreach methods. You all probably have access to methods that we haven't even thought of in Massachusetts and would make a big difference and are more effective here on the ground than they would be in Massachusetts. For example, you probably don't need somebody standing out at the commuter boats handing people brochures, whereas in Massachusetts, the Boston Harbor area was a great place to help educate folks. You have a challenge cutting through the political rhetoric. I know there are still people trying to defeat this law. It is the law of the land. I am inviting you to consider the difference that you're going to be able to make for the people of Missouri based on the experience we've had in Massachusetts. The only way you can do that is to help untangle some of the misinformation and directly speak to the needs of the consumers that you are trying to assist. It makes a tremendous difference, and I think you'll find you are enriched. Your agencies, your nonprofits, your organizations are enriched by understanding the consumer experience that you're actually speaking to around Missouri. I can't say enough about the variety of communication methods that have to be employed. You guys think about what bills or letters you don't open, what notices you don't open. I believe you'll find those of you who have health insurance occasionally probably don't open those on time. If you are someone who has never been insured before, if you are a family that doesn't have a generation that has been insured before, it's complicated. And so you have to understand about not just opening and understanding the notice, but what do you get for your insurance and how do you access it? It can be as basic as, I've actually never been, we talk to people at Healthcare for All who have never been to a doctor. I hope nobody in this room has that experience, but you will talk to people who have. And so they need to understand how to do that. And you will be able, again, because you've had a good direct conversation, you'll be able to do that. I will say that having these conversations is one of my great joys and one of my privileges. And I'm going to tell you a story about Carla. I met her yesterday between the airport and here. Actually, I've talked to two people, two business owners who don't have health insurance, so I want you guys to go find them. Carla works at a daycare center. I'm sure some of you know people who work at daycare centers. Daycare centers are germ factories. They're little kids with germs. And we need folks healthy and taking very good care of the youth of America and our young people. Carla, just yesterday, when I asked about, do you have insurance? What do you think about the law that's coming? What do you think about the federal exchange? She said that just yesterday, she had talked to her boss about it because she had interviewed this incredible childcare worker who was an early education specialist. But when Carla said, well, gosh, we really want to hire you. You have all the skills we want. Will you take the job? The woman said she couldn't because they didn't offer health insurance. So Carla's not insured. This woman, they can't recruit this woman to come work for them because she's not insured. And you can imagine what the boss's concerns are. Okay, is it too expensive for me to be able to buy for my employees? What do we get for the insurance? And how do you sign up? It's really complicated. So I will tell you, I promised Carla that I was going to talk to her after I had this conversation with all of you so that she will understand somebody to reach out to. Of course, I'm going to give her Dara's number, but she'll have other numbers too. And I will figure out which organization can go have the conversation at the daycare center. They're ready to sign up, but they need to know how to do it. I will also say there's somebody in this hotel who said he very much wishes he could offer health insurance, that his workforce would be more steady. He could attract more customers if he didn't have such a high turnover rate, but that he was worried that insurance companies take tons of money and you don't get anything for it. And I explained. One of my favorite conversations to have with people when I want them to consider becoming health policy nerds is medical loss ratio. Do you all know what MLR is? I will not take our time here, but I am happy to talk about it at cocktails. It has to do with the amount of money insurance companies are required to spend on your care versus on administrative costs. The Affordable Care Act has requirements for that, which we haven't had before. And I appreciate can be hard for insurance for the payers who will be subject to it. It makes a tremendous difference, I think, to consumers. So success absolutely depends on you. I invite you, go find, Carla is not the only one. There are so many people who are waiting and interested in the information that you have. I appreciate and I'm interested to hear how complicated this sounds at this point. 7 years out, this is like second nature for Massachusetts. We understand it. We are excited to be talking to people. One of the things that you all have on your table is, will you share your story? You guys, this is power. Being able to talk about your own circumstance and having those stories aggregated can be wonderfully powerful, not just in the legislative circumstances, but for your employees. I hope you've understood the direct benefit, and in some cases, the life-saving opportunities that folks at Healthcare for All in Massachusetts have had because of health reform. Each one of you, regardless of what your role in this new era is going to be, you have that opportunity, and I challenge you to walk into it boldly. Get smart about what you need to do, understand what work is in front of you, what the law requires and can do, and then partner. You don't have to know it all. But all together, folks in this room, you do have to know it all. And again, I know and hope in 5 years you will be among the incredible successes that have saved lives, have provided access to folks, and it's really pushing the healthcare system and the rest of us to make sure healthcare is a human right and not simply something that's a privilege for those folks who can afford it now. That is it for me. I would like to say we went through that in a whirlwind. I know it's late, but I wonder if there are any questions or any specific things that I can answer about Massachusetts or about what to expect. I am not surprised if your arms are too tired to raise. In the back, there are portable mics.
My question is, do you have any trouble with people applying for their health care, then life circumstances changing, where they have to either drop that coverage to go somewhere and get less affordable care, or change their lifestyle to get more affordable care because maybe they got a job or work someplace else?
It is such a good question. So I would say the first barrier is getting people enrolled. But then in Massachusetts, we put some protections in place so that the reassessment for eligibility happens once a year. So they should not have to lose access until a year is up. Now, if they've changed jobs and they have more income, yes, then subsidies can change. I would also say we think it's desperately important, and I invite consumer activists to think about this. Everybody agrees with this. Insurance companies agree with this. Providers agree with this. We have not found anybody to disagree with this, that continuity of care is desperately important. If somebody is in treatment, active treatment, for a terminal illness or for an illness that requires ongoing care, they can't lose access to that provider. I will, without having my head explode, I will say one of my very dearest friends does not live in Massachusetts and waited and waited and waited to figure out what was wrong with her because she doesn't have health insurance. And she went to the doctor and she was diagnosed with pancreatic cancer. She's late in the game for pancreatic cancer. Because she doesn't have health insurance, she's been shuttled around to different doctors. Her life has been shortened. It is unacceptable, completely unacceptable, and a reality for tons of people I don't know and we don't yet know, but it will be different when people have access to health insurance. So yes, it can be a challenge to keep people covered. It's important to keep coverage affordable, but people have to be continuously connected to the care that they need that saves their lives. Other questions?
I was wondering about the undocumented in Massachusetts.
Well, that's not really a fun thing to talk about. However, I will tell you in Massachusetts, we, and I get to walk around saying healthcare for all means all. All means all. You're a human being in Massachusetts, you have healthcare coverage and access to healthcare. I can go on and on about the economic arguments, about the human rights arguments. The fact is, in Massachusetts, you have healthcare coverage.
Are your healthcare providers on the other side of the equation satisfied with the reimbursement after all this happened?
Boy, that is also a really good question, and that was one of the worries. One of the things I didn't really talk about is in Massachusetts, we used an approach called shared responsibility. So we said as consumers, okay, we will agree to this requirement to buy coverage. Providers have to agree to take the coverage we've purchased. The government has to be available to subsidize coverage so that it's affordable, and employers have got to offer coverage. So there certainly was some concern about reimbursement rates. I spent a lot of time talking about the fact that the Medicaid reimbursement rates are insufficient for the care that we receive. When you look at the statistics, it's actually the Medicaid and Medicare patients who are subsidizing private pay insurance. So that's a challenge, and it is something that we get to now work on within the realm of payment reform. So we're working very hard on changing the delivery system so that payments are actually different than the fee-for-service system that most people live under. And that's part of what I hope I get to come back and talk about in 5 years. But you're right, that's a challenge. It turns out we didn't lose providers. Hi.
Hi, just a quick question. Is your enrollment period open all the time? A number of the examples you gave were kind of just-in-time enrollment.
Yes, so it used to be. We loved that. You could, and I totally understood. Insurers got really cranky about that people would sign up, have a baby, and drop it, which is consumer-centered, but apparently not as economically helpful as they want us to be. So we now have dueling enrollment periods. And that's actually something to pay attention to. I am certainly a glass half full human being, and I would say having the 2 enrollment periods actually puts a fine point on our communication goals. So you can't come and go. You need to stay in the coverage for at least 6 months. Any other questions? Yes, in the back.
Is there any political debate anymore in Massachusetts?
Thank you for asking that question. You know, we actually have a very interesting political environment in Massachusetts. We all sent you Scott Brown to the Senate, replacing Ted Kennedy, and the fact is, no, there have been no bills introduced in Massachusetts to repeal this. There was lots of talk at the beginning that that would happen, that this was just terrible, that this was going to be the end of business and the life as we know it in Massachusetts. And frankly, we worked really hard to have people understand what the costs are, what the benefits are, and again, now we are poised to take on the delivery system, which is a lot thornier than getting everybody coverage. So the answer is no. It would be political suicide in the state to say you wanted to get rid of this law. It is politically popular. There are people who talk about tinkering around the edges. Nobody's going to try to get rid of it. But again, that's 7 years post where you all are, so.
Thank you for being here. Could you talk a little bit about how Massachusetts is addressing the high cost of health care?
Yep. So I very much appreciate that, and that is part of the work that we have underway. We, because it was 7 years ago and not really on the national radar screen yet, we had the luxury of saying, look, we're going to take care of coverage first. Once we get everybody in the system, we are going to tackle cost. And again, as I said, we worked on the theory of shared responsibility, and you can imagine getting everybody coverage, almost everybody wins. There are some folks who are going to pay different out-of-pocket, and there are people who haven't had health insurance before who are going to have to pay. But we didn't tackle cost. So consequently, healthcare costs in Massachusetts continue to rise. Massachusetts is a very expensive jurisdiction to live in. We are now working, we passed, again, Healthcare for All worked desperately hard for the last 3 years to work on something called payment reform. Payment reform says that over the next 5 to 10 years, we want to pay for healthcare as a global payment. There'll be a budget to take care of me based on my demographics, my physical needs, making sure that providers, this is where we get into provider reimbursement rates, making sure my providers have no disincentives to take care of me, and making sure there are incentives for taking very good care of me. So right now in the system, if I'm really sick and I go to my doctor and she gives me, a prescription and a course of treatment and I walk out and I get healthy after one visit, she essentially doesn't make as much money as she would if I came back again and again and again for the same illness. So that is, that's treating for volume, that's paying for volume rather than value. I want her well compensated because I didn't have to go back to the doctor again. I'm healthy and productive. We're getting there in Massachusetts. And as I say, that's tough because if you think about it, we're going to pay more for primary care. Primary care providers are going to do great in Massachusetts. I am related to several specialists who their services will not be needed in the same way. So, somebody's payment is going to be somebody else's cost to somebody else. So, our pediatric, we have lots of specialists in Massachusetts. This is going to be hard. It's important to me that we continue to have world-class providers in Massachusetts. It probably means we don't need to have hospitals with, 2 cyber knives. One probably will do, but right now we pay for both. So it's going to take a while, and I think it's going to be challenging, but I'm confident that we'll be able to do it. Any other questions? Hearing none, I believe you have cocktails in front. Oh, no, I think Justin's going to say a few things. Can I just say thank you so much, and thank you in advance for the learning you're going to do, for the questions you're going to answer, for the peace of mind that you are going to be able to provide to people in Missouri. They need you. You are on the cusp of being wonderful experts on what this looks like. And again, in my experience in Massachusetts, you are the glue that's going to make this law successful. So I thank you in advance, and thank you for including me in your conference.
All right, you made it. Okay. So 3 more minutes, I promise, and then you are out of here. Thank you so much for coming today. We really appreciate having you all here. I love the slide with the big fish and the little fish and all of us little fish working together to tackle the issue of the uninsured. I will say that Amy said several times that she would like to come back in 7 years when we have gotten there, and I will say we're going to do it in 5. So I look forward to working with all of you and having Amy back in 5 years when we have our uninsured rate less than 5%.